We are joined by national nursing leaders for important conversations on future of the professions, workforce readiness, educations, leadership, policy innovations, shaping healthcare nationwide. At the Nurses Magazine, our missions is to elevate the voices and leadership driven meaningful change in nursing, patient care. Today, at the press conference, I am joined by one of the infamous, my icon, my leader, Dr. Jennifer Mensik. Help me to welcome Dr. Jennifer. Dr. Jennifer,
thank you.
How are you doing today?
Thank you. I'm very glad to be here and had a wonderful flight in last night. So thank you for having me and thank you for being here. It's so important to communicate what's going on.
Very good. The next, very first questions that I want Dr. Jennifer to tell the audience who she is. She is she's a national leader. I want her to tell the audience who she is, what she does.
Thank you. So I'm the president of the American Nurses Association. This is the third of my fourth term. I have been a nurse for 30 years. I started out as an LPN in a community college diploma program, got my ADN, and then moved into my RN to BSN and continued my education through my MBA and my PhD. So went to school for a very long time, but it was the easiest and best route for me. And I had a lot of wonderful experiences as a nurse in a rural hospital, long-term care, home care, and thankful for all of that.
Wow, we do have something in common. We do have something in common. As a matter of fact, I started as an LPN.
Wonderful.
I started as a tech in 1999. From a tech to LPN, from LPN to RN, BSN, so on and so forth. It's great to know that we do have something in common.
Absolutely.
Very, very good. Again, very nice to meet you. My very first questions for you. I want to tell congratulations on being named one of the Time Magazine 100 most influential leaders in healthcare. I want you to tell the audience, what does this recognition mean to you? Personally and professionally.
Thank you. This recognition was a surprise, and I am very thankful for the recognition. And really, this recognition is a recognition of nursing. And when I was talking to the committee, because they do an interview before they select, I thank them for considering nursing and considering a nurse, because oftentimes nurses are not seen and their value is not put out forth in the public's eye. And so this award, this recognition, really is the demonstration and the recognition of all nurses publicly and how we impact all of society and how we hold healthcare together.
Very good, very good. My next question's gonna, what is the most urgent issue facing the nursing professions right now, and what actions must leaders take immediately?
So we've got a lot of problems and a lot of issues. If I'm going to pick one, I'm going to talk about the Department of Education declassification of nursing for those professional loan limits. That's going to have unknown impact negatively on not just APRNs for the future, but on nursing faculty, nurses getting PhDs. And this will impact the number of nurses and RNs and LPNs that can graduate in the future. So we really need to resolve this issue. We need those loan limits adjusted so that we can go to school. We're trustworthy, we can pay our loans back. And we're the backbone of the healthcare system. We cannot afford to have any more of a shortage than we already are going to have.
Thank you, thank you. How should organizations address burnout while still maintaining patient safety and performance standard?
Thank you, that's a great question. And a couple of things. First off, one, I want organizations and I want people to recognize that, while humans can be resilient, we really need to focus on building resilience at a system level. So how are systems resilient? How are they built to accommodate the stretch and the slack and the emergencies instead of expecting nurses and other healthcare providers to kind of take on that burden. So from an individual perspective, and the American Nurses Association has our Healthy Nurse, Healthy Nation program, where individuals can really work on that well-being perspective on how they feel they want to interact, whether it's through communicating with other nurses and challenges, exercise, eating right. But then we also have a really great program through the American Nurses Foundation, through the Peer Stress program. All of these programs are free to all nurses, and you do not need to be a member at all, because we recognize how important this issue is. And what we've recognized in hospitals who've taken the American Nurses Foundation program and put it into place related to wellness, we've seen a 26 to 29% decrease in burnout in those nurses. So there are a lot of tools free available for organizations and for individuals that we would just ask people to take advantage of.
Thank you. Next questions. What policy change will have the greatest positive impact on nursing today?
What policy change? Well, if I had a magic wand, gosh, that is fantastic. I would, if I had to pick one off the bat, let's work on workplace violence. So I know we have advanced practice restrictions that need to be taken care of. We have staffing challenges in the hospital and workloads in our long-term care that are a challenge. But if we could focus in on one, let's look at workplace violence, because no one should have to go to work and be under threat. As you know, 1 in 4 nurses experience workplace violence, and nurses are more likely to experience workplace violence than those like a correctional officer or a prison guard. And that is totally unacceptable. So it's a hard, like almost a 4 or 5 way tie, but we do not need any more nurses dying or getting hurt at the hands of patients or family members.
Thank you. This is a huge issue that nurses are facing today.
Yep.
How can nurses increase their voice? I know these questions, you are very passionate.
Yes.
You're very passionate about these questions.
Yep.
How can nurses increase their voice at the legislature and national decision-making level?
Absolutely. So first off, becoming involved in your association. So whatever association that is, I would encourage everyone to join the American Nurses Association. Then you're also a member of your state association, but there are your specialty associations to belong to, because that's a way to exercise your voice. To exercise your standards of practice, your scope of practice. It's how you protect your license at the state level. The state boards of nursing aren't there to protect you. They're there to protect the public, which is why they're existing. But those state associations are there to help maintain your license, make sure you have your scope of practice, and that, for instance, advanced practice nurses can continue to have full practice authority. So it is so important, and I would encourage people, to start anywhere, right? Reach out to their friends or colleagues, start on committees, go down and meet your legislator. So all you need to do is know who your legislator is, send them a letter, write them a letter, call them and say, I'm a nurse in your district, and I would love to help teach you about healthcare and teach you about nursing. And I will be your expert. So if you ever have a question, they know who to call. It's about long-term relationship building, but at the end of the day, it would be wonderful if we saw more nurses running for office. And
Yes.
Office could be school boards, could be water boards, city councils, state councils, anywhere a nurse is, right? Everything is related to health and transportation, education, and so nurses belong there. And I think it's really important for nurses to really look at that and say, how can I help change the society and the community I work in? And there are just so many opportunities.
Yes, very good. Thank you. How do we ensure leadership reflect the diversity of the community nurses serve?
Absolutely. So one, we need to have faculty look like the nursing students.
Yes.
So we know a majority of nursing students are nurses of color. Our faculty are mostly white. And so we really need to encourage more nurses of color to go in to be faculty so that they can reflect it. We also really need this Department of Education issue. We know minority nurses are more likely to need loans to go to school. And so this is really important. We need to encourage programs to look at how they admit people and what barriers that may exist, and help bring people in and really do better recruitment efforts, because it is vitally important. If we actually are truly serious about taking care of people, we have got to make sure that we have the caregivers, the nurses, to match the communities in which they serve.
Very good, very good. What leadership lessons are you most proud of in your career? What?
So the leadership lessons, I think the biggest one I'm proud of is don't let someone tell you no. So I've had people tell me I was too young to do something, or that I have had kids, or maybe you should get some more experience before you go back to school and continue, right? A lot of people have their own perceptions about their lives that they want to put on you. And you know you the best. And I want each nurse listening to this to reflect on what they want and who they are, and make the decisions best for them, and not let anyone deter them or tell them otherwise.
What gives you hope about our professions? When I say our professions, I am a nurse.
Yeah.
What gives you hope about the nursing professions?
The hope I have for everyone is that the public trusts us. So we have half of an equation solved. They will listen to us to change the system and to make the system better, the healthcare system. We just need to rise to that challenge, right? We're all busy, we're all doing things, but nobody knows the healthcare system better than us. And so I feel the more we're out there, the more we're engaged, the more we really will change the healthcare system positively.
What advice will you give a nurse right now?
Right now?
Who are thinking about leaving the professions because of maybe burnout or for whatever reasons? What advice will you give to that?
There are so many things to do in nursing, right? So if you are in a setting and you are burned out, you don't need to leave nursing. Go to a totally different area, even if it's uncomfortable. I remember one of my first jobs was in pediatric home care from a rural critical access hospital. And I honestly took that first job decades ago because I didn't want to work night shift in the hospital. And that was the best decision in hindsight, because it opened up another world of clinical care for nursing that I probably would not have considered. And I've done home health for so many years now because of me just trialing an experience. And so go try something different and figure out a way to serve people, because if you're a nurse, the community needs you, and there's many ways to serve the community.
How does Dr. Jennifer wants to remember as the ANA president?
How do I want people to remember me? I want people to remember me as the person who asked them to go be advocates for themselves and to be political. There's a lot of nurses, not a lot, but there's more than I want, who say nurses shouldn't be political and that nurses should stay out of policy. There's nothing in your life, there's nothing in your patient's life that's not political. So if you are not political, you're living in someone else's political decisions. And I really want people to step into that comfortably. You don't need to go in fighting, but be diplomatic, advocate for yourself and for your patients. And that's what I want to be remembered for, is helping people to move comfortably into that role.
Last questions. From your perspective, a platform like the Nurses Magazine, what can we do to keep the conversations going with whether it's nursing burnout or issues that nurses are currently facing?
Absolutely. I think oftentimes there are organizations and nurses doing fantastic projects and programs that are making a difference. And oftentimes there's not a venue to be able to talk about it. Oftentimes in media, we like to talk about the negative things and not the positive things. But if we can demonstrate what's working well, people can learn from each other and then take from that and implement it themselves. So I would hope that media and your magazine can help share good evidence-based practices, highlight wonderful things that nurses are doing in hopes that others will share what they're working on and what they're doing successfully.
Madam President, our president, my president, it's a pleasure. I know you are busy. We will really appreciate it that you took the time to answer a few of our burning questions. Again, we want to thank you on behalf of the Nurses Magazine team. We want to thank you. Thank you for everything you have done for our professions. We definitely will remember Dr. Jennifer.
Thank you.
Thank you.
Thank you for having me.